Okay, good morning, good afternoon, good evening from wherever you're calling into. Welcome back to the Clintrix AI Podcast, where we explore more about healthcare, technology, the intersection, and how we're utilizing patient care. Today with me, I have Mr. Sathya, and he is the CEO and founder of Aidar Health. Mr. Sathya has a wealth of experience in chronic disease management, working with rapid medical assessment devices and AI-enabled triaging system for efficient management of chronic disease patients at home. He holds a dual master's degree from the prestigious Johns Hopkins University. Honestly, I will let him talk about himself, but I just wanted you guys to know we have such an amazing healthcare leader here today to talk to us. So thank you so much, Mr. Sathya, for being on the show today. How are you doing?
I'm good. Thanks, Laura. Really excited to be a part of this, and especially with the timing matters, right? And in healthcare, we see a lot of moments where patients are asked for more, caregivers are exhausted, and the systems are under more financial pressure than never before. So excited to talk about like how we are bridging that gap, and just as an introduction, yeah. I'm Sathya. I'm the founder and CEO of Aidar Health, and we are working on a technology that's helping the gap that we have in long-term care today with real data.
So can you tell us a bit more about your career background and how that sort of led you into founding Ada Healthcare?
Absolutely. I spent a lot of my time focused on I'm a biomedical engineer, and then I worked at Johns Hopkins on the innovation side, patient safety and quality. And then I spent a lot of time working with health insurers. So to understand different aspects of how we can use data to help monitor and help patients from having multiple chronic conditions. So what inspired me was my mother. She had multiple chronic conditions, and the challenges that she went through monitoring and managing her condition was kind of the reason behind for me to start the company. At one point, she really asked me, could you, with all your experiences in healthcare, could you help me prevent me from going back to the hospital? So that kind of triggered me to build a technology that can help act more like a check engine light for humans.
Wow, that's so inspiring. Honestly, I work as a nurse, and what I think I'm most inspired working frontline when I see families of patients that take that time that can be a really hard, challenging time in their lives to make it better for other people, whether it's through research, technology, innovation. So I think that's really, really amazing. Thank you so much for
No,
sharing.
it's great. I mean, I also want to thank you for being a nurse because it's a very special profession, and a lot of people with great empathy has to be a part of this role. And especially, I spend a lot of time these days in long-term care facilities, like skilled nursing facilities, and I see how much challenges nurses has to go through every day, every minute, every shift. So
Yeah.
it's really important, and sometimes it's more important than being a doctor in a long-term care.
Oh yeah, it's definitely a work of art. I definitely agree with you. Oh wow. So how do you see this technology that you've developed? How do you see reshaping chronic disease management and patient engagement in the next couple of years?
Yeah, so mostly, as I said, I think long-term care is something that people have always ignored, right? Because of the slim margins, and there's all patients most of the time are diverse, so there's always one size fits all kind of an approach.
Oh yeah.
And specifically, I think when we're talking about nurses, right? So we see there's a lot of they spend half of their shift in long-term care taking notes and focusing on patients as per their list and not based on the acuity, based on the risks of those patients.
Yeah.
And most of the time, like at least 30 to 40% of the time, the medications are wrong or provided at the wrong time, wrong dose, and sometimes missed completely because of the delays. So, which is why we wanted to initially focus on building a technology, one, help to monitor patients' health rapidly so that whatever it takes to monitor them on a daily basis. For example, a typical nursing home collects like maybe a blood pressure and pulse and sometimes temperature, but they don't have anything to measure the lung functions. They don't measure daily ECGs, right? And many other parameters. It's time consuming, So that's why we packaged everything into a single device. This is our medical device. It's more like a breathalyzer. Users can breathe into the device, and normally for a 30 to 60 seconds test, at the end of it, we measure more than 10 parameters, and all these parameters are combined into one simple composite index, essentially a health index. We call it AIDI or ID. What ID does is it helps to predict potential hospitalization or any kind of emergency event at a very early stage. So, in a nutshell, we provide a technology like a device and also a real-time intelligence platform for nurses in long-term care. So, as soon as a measurement is taken, they can see not just the data, but also the insights about patient's health, the medication was given, and if there's an impact on medication or any kind of treatment. Plus, all this data is collected in our physician portal. We call it the Aidar Connect. And more importantly, the entire data that is collected is sent to the electronic medical records. So we have a two-way communication. So whatever data you take on a daily basis using our system, it's stored securely, and it's available for analysis by any of the care team members.
Oh my gosh, that is so thoughtful. Like I'm just thinking, because talking about like long-term care, and I've actually worked in long-term care for a bit of my career, and I know how it could be taking care of so many residents. And just like you said, you have a checklist. Like you want to do your meds, your dressings, your moves, your transfers, your feeds, and everyone is like different. So you're trying to have not have the one size fits all, but still trying to do so much in your shift. And some of these tests you've mentioned, like lung function tests, ECGs, those are things they have to wait for an appointment to go to the hospital for. So I think that's preventative care at its finest, being able to just from breathing into a device have 10 plus tests. I think that's really great. So right now, do you find you're partnering more with American nursing facilities, or you're looking to also like branch into Canadian or any other countries?
Right now, our focus is in the US, but we have some partners in other parts of the world. Like we also looking into expanding to Japan, where in various senior living facilities. We also have some partnership in Peru and Chile. Canada is also definitely in our list. We're looking
We
into
would love that.
absolutely.
Yes.
If you could find partners or people interested in this, I would love to have a discussion with them.
Okay, I'll keep that in mind. Thank you so much. So, how do you balance the need to innovate your product with fiscal responsibility and still maintaining investor confidence? How do you find that balance? Because I know
Yeah,
healthcare businesses can have their unique challenges. So, from your experience, what has that been like for you?
Yeah, I think the most important part is not running after the shiny object, right? Every time every new company comes in and they say, okay, here's the new technology, here's a new wave, and then let's go follow that. For example, AI, right? Every company in the world right now talks about AI. They have some component about AI and whatever they're doing, especially in healthcare. It's going to be very hard to find companies who doesn't talk about AI. But
Yes.
AI only matters if it changes behavior, right? So what we are doing is to identify patterns of deterioration days before they trigger a crisis. For example, respiratory decline, infections, or cardiovascular stress. These are not really predicted using other off-the-shelf sensors. Sort of just flooding nurses with alerts, we answer one question: who needs attention first and why? That level of prioritization is where AI comes into play, and it also adds more economic value. When a staff intervenes earlier, we see fewer hospital transfers, fewer emergency calls, and fewer documentation errors. That's where every cost saving starts to compound, which is why we know, like almost 10 years ago when we started building this technology, we wanted to measure a lot of these parameters at the same time, and most people did not have the foresight like what we had. Many people ask us, like, why should we measure multiple parameters? My patient has only, let's say, COPD or a lung condition. A pulse ox is good enough. If I need lung functions, I'll send them to the hospital. Versus now, they need that. They need everything. Even for a COPD patient, it's a cardiovascular and respiratory condition, right? So we need to measure both those aspects. So how we really approach is to focus on what really matters. Can we build the intelligence or the engine behind AI works, AI can perform? That's what we are building. So our technology feeds into what AI can do. Without that objective data, it's going to be very hard. And even today, we invest a lot on sensors and new hardware capabilities because I think hardware is our moat, and I don't think any other company can replace what we are doing overnight. It's going to take many, many years before they can actually even remotely collect everything that we are collecting, which is what is our focus: consistency and focusing on building and innovating with clear validation and having FDA clearance and also having certifications. It's essential for us to follow that principle, not just in building hardware, but also building AI tools or softwares as well, which is what keeps us grounded, helps us focus on building the right technology, because at the end of the day, it goes into every single patient's hand, and we want to make sure that it's of the best quality and fully validated.
Wow, that's very insightful. And I think people that are starting up their own healthcare startups, that's something they could also learn from, that balance. And with Aidar Health, I think it's very impressive that you've been building this for the last 10 years. I'm sure you've had a lot of experience, lessons, and wins as well. How have you found that your experience has helped you with resilience? And are there any mistakes you might have made along the way that you think would be helpful for a new entrepreneur starting up to be mindful of with a unique, because I find, healthcare is very unique and a lot of people don't get that. It's more than just the profit margins because it's real people, it's real lives, it's real diagnosis, it's real families. And I think it's really a work of heart more than anything. So with your experience, how have you found that you're able to, remain resilient through the ups and downs? Any mistakes you may have made that you think would be helpful for our listeners to learn from?
Absolutely. I think there's no specific playbook for running any specific company. Every company, every startup, it comes with their own set of challenges. And honestly, the biggest thing for me is looking as starting any company like a marathon and not a sprint. And most people, the biggest reasons companies fail is people give up at some point. And when it's really hard, people often tend to give up, and which is where I feel like their motivation is driven towards, okay, I'm building something fancy versus I'm building something that's going to be impactful, even if it's going to take longer. It's very important. And I mean, as I said, especially with a hardware company, you make a lot of decisions on a daily basis. And for example, one such decision is our device already had a Bluetooth capability, but we also added a cellular capability, so that my focus was like, why should a patient sit and connect a device to a phone and then make sure every time it's connected? Instead, you use cellular data to transmit data every time. Although it's a fantastic thing for the patient population that we're targeting, but it also comes with a lot of challenges, right? So it took us almost 18 months to refine that and bring it into the market. So it's always important to iterate. Even with innovation, not always provide a lot of things at the same time. The other thing that I always seen is feature fatigue, right? So mostly people think that if you give a lot of features, people are going to really like. But most times, especially doctors, they look at it and think like, oh, this is a lot of parameters. I have no idea what I'm going to do with this. So they end up not showing that interest. Thanks to at least the recent innovations in AI, it's far more impactful. We can just provide just one number, and that tells you the trend of the patient, either it's positive or negative. So that kind of right now helping us to using all the data that we have and put together a simple index for patients on patients' health, so that the physicians and the care team members can act upon. So I think it's very important that you build in small pieces and make sure that technology works before adding new things to that.
That's really good advice. That's really good advice. And you talked about how, like with healthcare, like sometimes you think, you have all this solutions, but then the physicians are overwhelmed with all the data. So how do you find, or for your experience at least, how were you able to validate that market demand for your product before going heavy into marketing and manufacturing?
Yeah, I think for us, we spent like a little over 2 years to create this like product or come up with this product market fit. A technology like what we have fits into a lot of different setting, like home care, hospital at home. You have in hospital monitoring and can be used by athletes, quantified self people, and can be used in a lot of different settings to support monitoring of health. But for us, we wanted to see where we can actually touch more people and where we can have some kind of a healthcare provider support. And we also wanted to position our technology where there's staffing limitation or there's more patience was the biggest requirement for us, and we found like long-term care is where we have a lot of these diverse patient population where we can utilize our technology with minimum number of devices. We can just get to at least 100 to 200 patients per facility, which goes a long way for us. And also diversity of the data and patient population there adds even more value to what we are doing. Starting with one or two facilities, worked our way to multiple other facilities, showed the data, showed the value, and how much cost savings we can bring into place, and how many hospitalizations we can save. So all of those information was really helpful and act as a more like a marketing tool for us to get to other facilities. So that's how we slowly ramped up, and we didn't want it to put in without any testing. So for us, it was a great validation phase for almost a year. And from there onwards, we were able to more frequently deploy in other facilities.
Great advice. Thank you so much for that. So, when you look ahead for the future, what do you see as your biggest vision for your product? I believe it's AIDA.
Yeah.
Yeah.
So I think for us, the when we started, we wanted to collect hundreds of thousands of health parameters, which is why we decided to build not a device, but actually a platform. So today, although we measure around 12 parameters, the current ability of our device to measure all these parameters are basically only the beginning, because the access to breath and saliva in the mouth, we can provide access to many other biological indicators of health, which is what we are working on. So essentially, what we really want is to build a lab in your home, essentially using this device for a minute a day to get a comprehensive health assessment, so that ideally we don't want people to be sending any saliva samples to the hospital or any labs or going to a specific lab and give blood samples, but rather collect information from your mouth every single day at significantly low cost and at a really short time, and you can see the results right away. So that's our vision, and taking all these data to give a more meaningful information about patients' health every single day. So we're on track to collect the largest digital data set on human health. We're hoping to get to a point like where only people who are really sick need to go to the hospital, whereas things can be handled at home and we can predict things at a very early stage before it becomes an emergency.
Okay. Great. Very thoughtful, very, very forward thinking as well. And like you said, I think it's something that is not just limited to long-term care or hospitals. That's something everyday people could use as well, because limited access to healthcare or hospitals and facilities, that could be good for preventative healthcare more than anything. So thank you so much for your sacrifice into doing this for the last 10 years. I really love to speak with leaders like you that are so caring for the future of healthcare and wanting to make our lives better. So rounding up, if you could leave one piece of advice for myself and my listeners, what would that be?
I would say do everything with some empathy. More importantly, in healthcare, I always tell my team, would you give this technology to your mom and trust the data, and then take her to the hospital if something is wrong? And if the answer was no, I'd say, let's go fix it. Let's get to the point like where you really believe that this technology could help take care of your loved ones. That's the benchmark that I want to set. And I would say that's also something that I believe every single entrepreneur, especially in healthcare, should have that. Because once you establish that mindset, you start focusing on building for your family, for your loved ones, so that it becomes more than a job and becomes more personal. And also it doesn't give room for any kind of error, and people are not like looking into whoever is going to use it versus like my mother or my family is going to use it. So I would always think like if people can put that as a criteria for building anything and scaling, that would be great. And that's my advice I would like to give.
Thank you so much, Mr. Sathya. Thank you so much for all your words of wisdom. I wish you the best on your journey. And to my listeners, if there's anything you've picked up from this session with Mr. Sathya, I hope you remember whatever you're building, whatever you're working on, it's a marathon, not a sprint. Take it one day at a time, and always remember it's a work of heart. Be empathetic. If you cannot provide your solution to your loved one, to your mom, like Mr. Sathya has so wonderfully said, then maybe you should have a rethink. I think it's so inspiring that Mr. Sathya was able to be inspired by his mom to bring a wonderful revolutionary healthcare technology that could positively impact the lives of not just me, but everyone I could think about. So thank you so much, Mr. Sathya. It was such a pleasure having you. Everyone listening, I will be linking Mr. Sathya's LinkedIn in the description box. So feel free to connect with him, reach out to him if you want to learn more about Aidar's Health revolutionary product. And for now, thank you so much for tuning in, and I'll see you on the next episode. Thank you so much, Mr. Sathya.
Thank you.